Malek. I am the Wellness Solutions Manager here at the hospital. Thank you for attending. Jean's going to do her presentation on the importance of becoming your own health advocate.
Hello, I'm Jean Wray, Patient and Family Education Coordinator here at Doylestown Hospital, and my main role is to make sure that information is provided for the patients and families of our inpatients, but we also want to reach out to the community for our outpatients, for people that are our prospective patients, so that you know how to be your own healthcare advocate, okay? So we will start, and here's a quote from a famous man, Benjamin Franklin: "Tell me and I forget, teach me and I remember, involve me and I learn." Okay? So in order to be able to be a participant in your health care and be your own health advocate or the advocate of a loved one, someone else, you have to be a participant in your health care. Now, what I wanted to start with, and this may be very, you may know a lot about this, I don't know your professional role or anything, but I felt that we needed to review learning styles of people, because we all learn, I think, 3 basic ways, but we may be stronger in one way than another. So people who learn visually are the people that are going to come, they're going to look at the slides, they process information best when it's illustrated. So they like pictures, they like graphs, they like things to be demonstrated, they like written material, those illustrations, images like that, and they like to take notes. They will ask that verbal instructions get repeated, okay? So just think about this in the way that you learn mostly. It helps you identify what you're going to need as a healthcare consumer. So people that learn mostly through auditory is hearing. They process new information best when it's spoken. They like to listen. They like lectures. They probably don't fall asleep during a lecture like some people do. They prefer group discussions because that's how they learn. And they like to hear stories that reiterate the information. Now, when someone is a kinesthetic learner, they're those hands-on people. They like to do, they like to touch, they like to manipulate things. They want to examine objects, they want to participate in activities. They just want to do it, but they need frequent breaks. So like I said, all of us, I think, are a blend of the 3, but you might be predominantly one kind of learner versus another. And this is important to know, like I said, so you know how to get information the best way that suits you. So people learn best through active participation in learning. We remember about 20% of what we hear, I have 20% of what we hear, 50% of what we hear and see, and 90% of all 3 things, the things you hear, see, and do. So information presented in all those 3 ways provides the learner with the most opportunity and the greatest retention. So just think about that. How do you think you learn best? Maybe you've never thought about that before. Maybe that's caused a gap in your being able to attain your health information because maybe your healthcare providers have provided it for you in a way that's not the best way for you to learn. So, do you learn by hearing the information, by seeing it, by doing the hands-on activities, or by all 3? Most of us are a combination of all 3, but stronger in one than others. So it's your right to ask your healthcare provider to explain things the way that you learn best. So, these are scenarios that you could say if you identify that. I learn best with illustration. Can you show me a picture or draw me a picture? And you can ask for printed language in plain language, it's called, which is everyday speaking, things that are easy to understand, not medical jargon, okay? Because that's confusing for people. And we'll talk a little bit more about that later. I learn best by listening. May I record our visit? More and more people are doing that because do you know how you feel when you're in a healthcare visit? You know, you get there, hopefully ahead of time you'll make some questions. If you don't, you think you've got it all in your mind. You get there, you're in that gown, on the exam table, and everything you were thinking of goes out of your head. And then after you leave, you remember the questions, you say, oh darn, I didn't get to ask what I really needed to ask. You call back, you know, it's a waiting for a call back. So what you can do then is, if you learn by listening, what you can do is ask your healthcare provider to slow down when they're speaking, to avoid that medical jargon, to really only give you the key points of what you need then and there to help you understand. Okay, and we'll go a little bit more into that later, because information overload, everything just gets all jumbled. You really don't understand it because you didn't hone in, you weren't able to. So you need your healthcare provider to give that to you, to give you the most important information, because too much, especially if it's a new diagnosis or a new problem, too much at once is very confusing. You can also say, I learn best by doing. So after you show me how the glucose monitor works to test my blood sugar, I'd like to show you how I think it works. That gives an opportunity for the correction to have it done properly so that you get the test results that you need. The same thing with inhalers. I go to a lot of health literacy seminars and look at videos on health literacy, and they're real life patient situations where the care provider gave the inhaler to the patient, and you're going to laugh when probably, I'm hoping you get a chuckle out of this, but it's kind of sad, gave a inhaler for breathing to a patient, never asked for a return demonstration, never showed the patient how to use it. Patient comes back, not getting good results with their asthma, and the provider finally said, well, show me how you use your inhaler, and the patient went like this, thinking they had to breathe it in that way. Not the patient's fault. So there's a lot to learn. There's a lot of information. We're living longer. Medical science is getting more sophisticated, and I think with that becomes more confusion. So let's talk about, in a moment, we're going to talk about health literacy. So out of the participants that are here, if you're willing to share what you think health literacy is. When you think of the word literacy, what do you think of?
Did you understand it? You have correct information.
Mm-hmm.
You know something about it.
Mm-hmm. And a lot of times the word literacy is tied to a grade level of learning. Okay? Well, health literacy, the definition of it by Healthy People, it's a government. Healthy People was a 2010 initiative, and they have a whole list of things they want to accomplish for the public. Healthy People 2020, now they've set new parameters to and goals to achieve by 2020. They define health literacy as the degree to which an individual has the capacity to obtain, communicate, process, and understand basic health information, not real complex, but basic, and the services to make appropriate health decisions. That applies to be able to do that for yourself, or if you are the health advocates for someone else. Okay? So we can't really talk about self-advocacy, health advocacy, if we don't discuss what health literacy is, because health literacy impacts the way we communicate with our healthcare providers, speaking the same language. So don't let poor communication keep you from seeking health information. And if your healthcare provider can't or won't honor your learning needs, switch providers, right? Have you ever done that? Because you just weren't in sync with that provider. You weren't getting what you needed to be able to understand your healthcare. So you switch providers. Really, it's not a personal attack against anyone. It's just we don't communicate well with each other. So for some people, it works with one person, and you know that in your life relationships with people, how you get along with different people. So apply that for yourself as far as your self-advocacy and your health literacy. Because of poor health literacy, 50% of patients leave their doctor's appointments not knowing what they're supposed to be told, what they're supposed to do, or what they were told. Because you get intimidated. You're afraid to ask questions, especially if your healthcare provider says to you, phrases it this way, well, do you have any questions? With my hand on the doorknob, do you have any questions? Right? How do you feel when somebody says that? Most of the time, what is your answer going to be? No, it's fine. And then you leave and say, what the heck just happened? What was said? People are embarrassed to ask questions. They don't know what to ask. That's why people don't know what they were told. And then patient goes back to see the healthcare provider again, and they say, your blood sugars are so out of range. Why aren't you testing properly? Why aren't you doing it right? Well, they never knew what they were supposed to do, and nobody asked them for feedback. There's something also called teach back, where a health care provider ideally should not use that closed-ended question. Do you have any questions? It should be more, we've reviewed a lot of information, so tell me, what other questions do you have? What can we go over again? What's going to help you? Okay? Poor health literacy is a stronger predictor of a person's health other than age. Okay, we may think, well, people as they get older, they don't hear as well, they don't see as well. They probably also have the attitude that my doctor's the boss, my doctor's in charge of everything. Well, what's that new medicine for? I don't know, my doctor gave it to me. So we may think people aren't as prompted to ask questions. It has nothing to do with income, employment status, education level, or race. So don't be fooled by people's appearances, where they live geographically. You know, it's typically, there's an attitude that in this area, we don't have a health literacy problem because we have educated consumers, and we do. But our healthcare providers still speak a lot of jargon, assuming that our consumers understand what they're saying. So just be aware of that. So why is health literacy even important? Because it can provide clearer and better communication between you and your healthcare provider. It helps you be your own advocate so you can make more informed decisions about your health. Okay, or someone else's. Sometimes you're that advocate for someone else making those decisions. You're going to have better health outcomes, fewer complications, and prevent relapses. Now, I used to have on this one what this meant, but I decided to take it out because I want you to take a guess. And are any of you healthcare providers or have a degree in health? Because if so, you know, this might be clear to you. So this poor guy had an x-ray, and the radiologist or his doctor, I don't know who it was, gave him the report and said, you've suffered a contusion to the soft tissue below the fourth thoracic vertebrae, exacerbating the proximal sternum. Holy moly, wouldn't you think you were dying? What do you think that means? Take a guess.
It's a bruise.
How'd you figure that out? A contusion. You knew that word? Good. It's a bruised rib. That's all it is. But when somebody speaks to you like this, okay. A lot of people are becoming more bold in their advocacy, for lack of a better word, and they'll say, so what does that really mean? And then when a doctor says to you, your test result was positive, well, is that a good positive or a bad positive? Or if it was negative, there's plenty of test results you want to be negative, but there's others you don't want to be negative. So that's not a lot of clarity either in giving you information. So if your healthcare provider communicates to you in this way, speak up, okay, ask questions. There's no shame or embarrassment in asking things to be explained in simple terms. That only not helps you, it's going to help other people. If that healthcare provider says, boy, more and more people, hopefully more and more people are going to ask questions when I use that term, maybe that's what I should be using with my patients. Maybe I should communicate clearer. So that gives you the ability to be empowered and to take control of your health. Because when you think about it, if you don't have any chronic conditions or ongoing medical problems, how many times a year do you see your doctor? Maybe once, twice, maybe, right? Annual checkup. So those other 364 days of the year, who's your healthcare provider? Yourself. If you think of it that way, and it helps you realize you need to speak up. You need to ask questions so that you can be empowered and take control of your own health. Even people that have strong literacy skills, these are people that maybe have a degree in engineering, may have trouble, or any other higher degree, may have trouble obtaining, understanding, and using complex health information, such as understanding prescription or medicine labels. Okay? Now our pharmacists have to type out in plain language on your prescription bottle what you're to do. But back long ago, if the doctor wrote it, take one with a one, a line, and a dot over it, QD every day, that's how it was written. So now it's written in plain language, hopefully that's what you're seeing. Take one 3 times a day, 8 hours apart, that kind of thing, okay? But think of medicine labels, and this is another health literacy resource that I've seen, where just think about something as simple as a bottle of aspirin. First of all, if you're buying the minimal amount of tablets, the print's even smaller because the bottle's smaller, right? So those, and you have to know numeracy to be health literate also. So those labels may say, take 1 to 2 aspirin every 4 to 6 hours, not to exceed so many doses in 24 hours. Well, there's plenty of people that don't know how to interpret that. It's very confusing for them. It's not simple. Long ago, when I was a new nurse worked in a critical care area in Philadelphia, there was a Philadelphia police officer who had been given a prescription drug for migraine headaches. I don't know how the prescription was written on the bottle, but it obviously wasn't written clearly, because the label was supposed to say, take 1 tablet every 4 hours. I don't know his history, but he read it as take 4 an hour. And he ended up on a ventilator and he died from brain death. And that's a person who you are relying on to save your life as a police officer. So he's got skills. He or she, I should say. They've got great skills. But this medical language isn't clear to them, and it obviously wasn't made clear to him. That's another area for teach back. So tell me, when you go home, how are you going to take this new medicine? Right? So the provider should verify that you understand how you're supposed to take it, any side effects it might have. And ideally they could say to you, so we just talked about 3 side effects. Can you name one of them? So that when you go home and you tell your husband, your wife, whoever you live with about your new medicine, how would you describe it? What it's for and what a side effect is. These are things that are up and coming. Well, this has been in place for a long time. It's called Teach Back, but that you should really be expecting from your healthcare providers so that you're clear. Appointment slips can be confusing. Think about when somebody says to you, your appointment's at 11 o'clock, arrive 20 minutes early to fill out the paperwork. That's another numeracy problem. Not all people can do that math. So really, the best thing to be said is, can you arrive at 10:40 so that you can fill out your paperwork? Right? Filling out health forms, is that confusing? Have you ever had it, yes or no? Have you had a relative? How are they related? That kind of thing. And instructions for diagnostic tests. When we have central scheduling here at the hospital, if you've had outpatient studies, diagnostic tests, that person that schedules that for you when you call that number is supposed to give you the instructions for the diagnostic test, what you're supposed to do. Not here, but in another facility, there were patients coming into the GI lab to have endoscopies, colonoscopies, and obviously they weren't getting the proper instructions on how to prepare for that because they were coming in unprepared. It backed up the whole system, so patients would have to be canceled. And once all they did is created a script that everyone got the same instructions that were very clear, once that happened, things were smooth again. Patients came in prepared, they went through their day, and nobody had to have their appointments rescheduled or canceled. So that's another thing, just make sure you have that clarity in how to prepare for something. It's not always easy when somebody says, well, here's the prescription, go to the pharmacy and follow the instructions, because they're not always clear either. So if you have questions, ask. Because even educated and competent people with those strong literacy skills have trouble understanding that information. Think about, I don't know if any of you are professionals that may be in law, in insurance, in working for a mortgage company. But think about whenever you've bought a new car, a new house, signed up for a new insurance policy, you're executor of someone's will. All that is foreign language to you, and it's reams and reams of paper that they just say sign here and then we'll process it. So you need that agent to interpret that language for you. It's the same in healthcare. You need an agent to help interpret that for you. So don't be fearful or ashamed of not being able to understand, and don't be afraid to ask questions, because when one doesn't, it can have negative consequences. Like the police officer who took the medicine wrong. That's a pretty bad negative consequence, death. So sometimes this is out of your domain. So why is self-advocacy so important? Well, ideally, your doctor should really know you as a patient, a doctor, nurse practitioner, physician's assistant, whoever your healthcare provider is, and always communicate at a level that matches your knowledge. By knowing you, they know that. Because communication is crucial to good health care. So be proactive about being your own health advocate before you get sick, because it's tougher then. You're focusing on other things at that point when you're sick. So what is a self-advocate? A self-advocate is somebody, whether in health or not, who's good at letting other people know. We all know people like this. They're clear. They let you know what they want, what they're thinking, what they're feeling, what they're needing. Okay? Sometimes self-advocacy means asking a lot of questions and asking and asking and asking until you really understand. Sometimes it means helping other people understand what's important to you and asking for help when you really need it. It doesn't always mean that you're going to get just things to be just the way you want them to be, but you have the skills and the confidence to communicate your wants and needs, and that's an important first step in reaching your healthcare goals. A person that makes an informed decision about a matter that's important to him or her takes responsibility to bring that change about that needs to happen. So when you make informed decisions by asking questions, you find out all that you can and take responsibility for the change, because it's your health, it's your disease, you're your doctor the other 364 days, healthcare provider the other 364 days of the year. So just think about how you express your needs best, okay? How do you do this as a person? So here's some tips on being a self-advocate for healthcare. Communicate as best you can what you're feeling, think, or you're needing. Ask questions, and if necessary, ask them again. Write them down before you go so that when you're there in that patient gown, feeling vulnerable, you're not going to forget the important things you need to ask. Okay? Do what you're able to do for yourself, but don't be afraid to ask for help when you need it, so that you can make healthy lifestyle choices. Okay, you also need to understand your own health, because these are the most important things to remember about health and healthcare advocacy. Prepare to see your doctor, do your homework. I mean, Dr. Google can give you a lot of accurate information and a lot of inaccurate information, right? You just put something in Google. There's a lot of people that challenge their healthcare providers with things that are on the internet that really aren't at all scientifically valid. So just be careful. In the packet that I gave you, there are, from the National Patient Safety Foundation, reliable health education websites to go to get that information, okay? Also, we talked about this earlier, sometimes it's been deeply ingrained in our culture that our doctors are the authority figures, and look at all the school they went to, look at all they know, but you know yourself. You need to make your needs expressed. You need to express your needs and get your answers. You should also expect to be taken seriously and treated with respect. And remember that taking care of yourself and your health help you reach the goals that matter most to you and live the life that's right for you. So who's the most important person on your healthcare team? You, right? You've got all these, you may have They may include all these other modalities, some, and one of the participants was speaking to me before the presentation, and she said that her mother, she was trying to be her mother's healthcare advocate. Her mother was hospitalized and then transferred to another facility, and she was so unclear on people's roles. Who was the doctor for this? There was a different doctor in the emergency room. And then when you come to most facilities now, it's a hospitalist that sees your patient, your loved one or yourself. Very confusing. Then if you need care beyond a hospital, so you need a cardiologist, a pulmonologist, heart, lung doctor, you need an infection prevention doctor, a specialist. You get all these specialists coming to the bedside, and it's very unclear who is doing what role. So, as the most important part of your healthcare team, you should feel free to ask any member questions and get clarity. Who are you? What is your part in my care? That kind of thing. So that everyone that's involved in your care, from all or any of these modalities, is clear that they're working towards the same goals that you are for your health. That's the first thing that we need to know from our patients is, what is your goal? Because if we're preaching another story and that's not the patient's goal, they're not going to hear it. I use an instance like this. Person has high blood sugar and they're told that now they need to take insulin, an injection. They're scared to death of needles. Nobody ever asked them about that. They have a loved one who, a generation or two ago, took insulin and had all the problems from high blood sugar anyway, which now the care is so much better. You test your blood sugar, regularly instead of after it's elevated. The medicines are better, the care is better. So they have all those negative things, those walls build up, but maybe no one ever asked them. So I'm going to show you how to take insulin. Here's what it looks like, here's what you do. It's not going to work if that person, they don't know what the patient's goals are, what the patient's fears are. So that needs to be clear, but part of that is your responsibility to be the most important person on your healthcare team. So remember to trust your healthcare provider. We talked a little bit earlier that if you don't have that relationship with that person, it's okay to go to another practice. Communicate what your needs and priorities are, because an actively involved patient knows what he or she expects from a doctor, and they share in their medical decision making. Your healthcare providers have a duty to help you understand. So that's how you can, they should be helping you understand and follow your treatment plan. Know and manage your health risks. Keep your personal health records. I don't know, do any of you ask for copies of everything when you go for an appointment? Keep your own healthcare records, because sometimes you're going to be the one to find an error. They're following a certain blood work study, and sometimes it's not apparent to that healthcare provider, and you can see the subtle changes in it when you're keeping your own records. Okay? Also, you can bring a friend, because 4 ears are better than 2, right? Sometimes you're so caught up in a new problem, in a new diagnosis, that it's harder for you to hear what's said to you and what you need to do, because you're back there thinking about, oh my gosh, now what? I have to change my life, I have to change my behavior. You're somewhere else, and that healthcare provider has 10 more minutes, 5 more minutes to give you the information they feel that you need to have. So sometimes having someone else there to hear, then you can say, what just happened? What was said? That person could take notes. That person could record the conversation. So you can go home and listen to it again and make sense of it. Because medical people like to use big words, and they like to speak jargon, okay? And you get deluged with information when you don't know to ask for plain language to be spoken. So that's why if you don't understand, you need to ask. No, when you get a new prescription for a new medicine, know what it's for and what its side effects are, okay? And how to take it. So don't be afraid that by asking questions, you're going to look stupid, you're going to put your healthcare provider out, they're going to have to take more time with you. they will tell you, and I know that in reality that happens, they think that you're there to have your blood pressure rechecked, okay? And then you have this whole list of other medical problems that they've only allowed for a blood pressure check in the visit, so then it delays someone else in the waiting room. So what you do then is you make another appointment to be able to discuss those issues. And hopefully you'll be prompted to do that. So we alluded to this earlier. The 3 most important questions to ask to take care of your health are, what is my main problem? What do I need to do? And why is it important for me to do this? Because we're all adult learners. Somebody's not just going to say, you know, you've been doing the same thing for 54 years. You got to change it starting today. Well, why? Right? Isn't that what we're going to say? We're not 2 years old. Well, they're pretty defiant too, but we have a history that we have behaved a certain way, and when someone tells us that they want us to change our health behavior, we need it legitimized. Why? What's the problem? What do I need to do and why do I need to do it? You tell me from what you see. That's where you're depending on that healthcare provider's knowledge to share it. So by keeping a healthcare journal, and keeping copies of all your records, your imaging reports, your pathology reports, business cards of people you talk to, right? Because sometimes they visit you in the hospital, you can't remember, it's a social worker, it's a case manager. They should all have business cards. Keep them. We have, if you're in the hospital, if you're not and you're in a provider's office, they should also be able to give you the business card to be able to get back in touch with them if you need to. If it's a new provider especially. Write down all the supplements that you take, all the medicines that you take, so that your doctor is aware of it, all doctors are aware of it at all appointments. There are some herbal remedies that interfere with anesthesia, so that's why it's important for your surgeon to know what you're taking, because it may need to be stopped. It may change your blood pressure with anesthesia, it may affect your bleeding with anesthesia, you know, surgery. So that's important. Some people think over-the-counter and supplements they don't have to report on. They just write down their prescriptions and let everybody know. But more and more people are are into alternative medicine and taking other things other than prescription medicines. So it's important for your healthcare providers to know that. Also, when you have a scheduled appointment and you know it's to discuss your cholesterol level, your blood sugar level, any other thing that is your thyroid level, that kind of thing, get your lab work done before the appointment so that when you go, you can get a copy of your result and you can sit there as 2 intelligent people and make the best decisions for you in shared decision making. Because what happens when you go, you get the appointment, you get the slip to get outpatient labs done, you don't know whether you're going to hear anything or not. Some offices believe no news is good news, I'll only call you if there's a problem. Some things get slipped by the wayside and then you're thinking, should I call? Should I call? I don't want to bother them. Should I call? Sure, call. See what that result is so you know it and ask it to be sent to you. Okay? So finally, George Bernard Shaw said that the single biggest problem in communication is the illusion that it has occurred. And that can be an illusion for any of us. So in the packet I gave you, I'm not the kind of person that gives you copies of a PowerPoint because I think that's boring. It's just more reference material on how to be your own healthcare advocate, to document, to research legitimate websites. Go to the library, ask the research librarian to help you, to take notes, to track your records, not to be shy, okay? And also tips to navigate the modern medical system. This is interesting. A lot of it is about office appointments and knowing when the best day is to call, when the best time is to call, who you should speak to, you know, establishing a rapport with your healthcare provider in the office. Because fortunately, I mean, I'm hoping that fortunately, most of your healthcare is provided on an outpatient basis, and you don't need to be so sick that you need to come to the hospital. So by being an advocate for yourself in your doctor's offices, that will hopefully help provide, have hospitalization be something that's not going to need to happen for you. And about getting prescription refills. It's a lot of information. There's also, now don't be Don't be put off by some of these that are from the National Institute for Aging, thinking I'm not old, but these are just good tips for anyone on getting ready for your doctor's visit, making good use during your time with your visit with your doctor, and remembering what they say, and it's all that we just talked about. And also pharmacy safety. Making sure that your drug labels are labeled in a way that you can understand, that you know how to take that medicine, that you know, and you probably all know when you go to pick up a prescription, how many of you are asked the question, do you have any questions about this drug? You do, and I think it's mandated that that's to be asked, but it's not always. I haven't had that experience. They just say sign here, and I know that what I'm signing is that I declined to any information. So just be careful about that, okay? That's your opportunity to ask an expert information about that drug. So you need to know what to expect when you pick up your medications at the pharmacy, and know more about them. And then the final thing is those recommended healthcare links for you. Okay? Does anybody have any questions? I will attempt to answer. If I don't have an answer, I will get back to you with it. If something that I can't be confident giving the answer about. Well, thank you for coming. I hope that it was valuable. Good.